Hello, my name is Lorna Morgan. I'm one of the lung cancer nurse specialists, and myself with my colleague Joanne Anderson are going to discuss the lung cancer service at South Tyneside and Sunderland NHS Foundation Trust. I am now going to introduce you to our core team, starting with the clinical lead. The clinical lead is responsible for ensuring the service is following the recommended lung cancer pathways correctly within the relevant guidelines. They will inform the team of any new changes to practice, chair the multidisciplinary team meeting or MDT, as well as many other tasks. The respiratory consultants will see patients initially referred to the service with suspected lung cancer and will follow the patients up until they have a suitable treatment plan. If appropriate, may keep the patient or refer to the relevant specialists for treatment. They will also follow patients up for 5 years following surgery or oncological treatments. There are specific radiologists who specialise in lung cancer and will report any chest x-rays, CT scans or other radiological tests that may have been arranged. They can also perform CT-guided biopsies to obtain a sample of the lesion to help with diagnosis. Cardiothoracic surgeons will see patients that have been investigated and may be suitable for surgery. This may include removal of part or all of the lung. Consultant clinical oncologists will see patients identified by the MDT as suitable for systemic anti-cancer therapies like chemotherapy and radiotherapy. Once their treatments are complete, they will refer patients back to the relevant respiratory consultant for follow-up. Consultant medical oncologists will see patients identified by the MDT as suitable for systemic anti-cancer therapies. Lung cancer nurse specialists will support patients and their relatives from the beginning to the end of their journey. The Macmillan Lung Cancer Care Coordinator will pick up patients that have been referred to the team with a suspected lung cancer. They ensure patients are seen by the respiratory consultants in a timely manner. They will ring patients, answer queries and support the teams with the care of patients on a lung cancer pathway. The MDT coordinators will track patients on a lung cancer pathway to ensure that they are discussed at MDT once all investigations are complete. They support the teams at MDT to record outcomes. Clinical trials officers or research nurses will discuss any trials that the patients are eligible for so they can make an informed decision whether to take part in the trial or not. If patients decide to take part, then the clinical trials officer or research nurse will support with the recruitment process and collection of research data that could lead to a change in care in the future. If you have any queries about the above information, please contact your lung cancer clinical nurse specialist.